For anyone who's taking advantage of our continuing ed credits, this session has been approved by the Ohio Nurses Association. So the credit will be awarded based on your participation and, of course, the completion of your evaluation form, which I am putting the link up here. I will also add it to the chat later on in this session to make it easier for y'all. You can just click on the link that I post in the chat. Okay, and again, if anyone has any questions regarding our medical CEUs, please contact Mary Ellen, and her telephone number is up on your screen.
Wonderful. Well, in the essence of time, we are going to get started. I have the pleasure of introducing our speaker this evening for our first medical roundtable. So tonight we are joined by Dr. Kay Wagner, who is a board-certified pediatric hematologist-oncologist with more than 15 years clinical experience. She is currently practicing at Sanford Children's in Sioux Falls, South Dakota. In addition to her clinical duties, she is the principal investigator for the Children's Oncology Group site at Sanford Children's. She has been the medical director and camp doctor for Camp Bring It On for the past 10 years. She is an assistant professor of pediatrics at the University of South Dakota Sanford School of Medicine and is the associate program director for the Sanford USD Pediatric Residency Program. Dr. Wagner currently serves on the COCA-I Board of Directors as president-elect. She is on the Gold Ribbon Committee and is a medical reviewer and visitor for the Gold Ribbon Program. Welcome, Dr. Kay. We're excited to have you tonight.
Hey, everyone. Lauren, if I'd known you had to read all of that, I would have cut it down. Sorry.
That's okay.
Really, the most important part tonight is that I get to be here with all of you guys who are involved with doing the medical part of camp. So, and really, I get an easy speaker role because I just get to help moderate this great group of folks. Let's see, it looks like we have about 24 people on. So I'm going to start by throwing it out and see what people want to talk about.
I'm also going to add, if you feel more comfortable communicating over chat, we'll be monitoring that as well. So feel free to throw questions in there.
So I'll throw out a question. What's been the hardest part for those of us that are on the medical side about not having your regular camp this year? What's been the things that you've been struggling the most with that?
Hi, this is Deb from Camp I Hope.
Hi,
Hey, for us, it was keeping the rest of the medical staff involved.
Okay.
And then I think the other thing was just knowing it was hard emotionally for a lot of us because there's some kids who most likely won't make it till next summer. So that was kind of what we struggled with.
Okay. Anybody else?
Hi, my name is Camille Ramey. I am the medical director of Arizona Camp Sunrise. And we struggled a lot. Arizona was a hot spot in July, for sure, which is when we hold our resident camps. It was the connectivity. We did an amazing program called Camp on the Move, where they put camp into a box physically with all kinds of games and toys and activities. And it was wonderful. But we had a camper who, like Deb just said, it would have been his last year. We did a drive-by parade for him. Unfortunately, though, the kiddos that I was in contact with and my fellow volunteers, we just missed touch. We missed hugging, and we understand. We totally understand, and we're doing it to keep ourselves and everyone else safe. But that was a profound void over the last summer for all of us, I think.
I completely agree. Other folks?
This is Susie from Camp One Step. I would have to agree with Deb. I think finding opportunities to keep the medical team engaged and now keeping them from being poached as counselors because they did such a good job. You know, they kind of worked as a medical liaison, but really functioned in more of a counselor type role. We tried to have 1 to 2 medical throughout the week in our 7 different programs, and you know, they all got like 5-star reviews at the end. So they've already taken like somebody to be a group leader for winter camp, and I'm like, oh, when we get back in person, we're going to need that individual. So I'm a little concerned about the future of that, and what that's going to look like moving forward.
Okay. Anyone else think you're going to lose staff to the program side now that they've been found out by that other side? Now, normally this group isn't so quiet, so maybe I should stop talking and let someone else bring something up.
I'll bring something up, I think, that may be weighing on a lot of people's minds. Obviously, the ACA field guide for 2021 summer camps come out, and you know, we've started to actually work through that and try to be optimistic about being together this summer. But I think there's so many different recommendations in there that I think it would be wonderful to start working together again on a regular basis to talk through some of that and how that might affect us. Because again, you know, we don't have paid staff who can quarantine for 2 weeks like some of the camps did this summer, and so there's going to have to be some nuances specific to our patient population. We're probably going to need to look at some reduced numbers. Do you know, have people? Do you have kids that are on active treatment? Do you exclude people who refuse to get the COVID vaccine? You know, what's all that going to look like? And so I personally, you know, it would be wonderful to have some opportunities within this group to begin talking through some of that, and how you're going to screen, and you know, the large number of kids we bring, and you know, there a lot of the programs actually screened pre-camp and then screened upon arrival, and then screened, you know, actually tested is what I mean, midweek. So, you know, what are we going to be looking to do as an organization association?
Sure. Anyone else started diving into these guidelines or having these conversations yet?
No, you know, we're not. We're up for certification this year. Well, it was last year and then it was deferred. And I also volunteer with another camp in Colorado. It does a ski camp. It's really neat, but not a part of COCA that I know of. And the medical director there just shut it down. And then, you know, that has further reaching effects on fundraising. If they're not able to hold their fundraising events, how does that affect their programming? So what we're talking about for that one is just decreasing the number of kids and deferring the entire program till 2022. At Camp Sunrise, you know, we're optimistic that we can hold in-person camps. We had a little bit of a discussion about the vaccination, and I think that falls in line with our existing vaccination policy, which unfortunately excludes families that opt out of vaccines altogether. So, you know, but what does the vaccine look like? What is the, you know, this coming out from Pfizer, I heard today, really only lasts about 7 days. So, you know, I think there's just so many unknowns. My question for you, Dr. Wagner, and for anyone else in the group is, what pediatric oncologists are you aware of? What kind of chatter is there about even being comfortable sending kids to an in-person camp? Let's say, like, we have a winter program and a spring program as well. We've kind of ixnayed those. What's the, like, if I can take everybody's temperature, how does everybody feel about the coming months, like the next 4 or 5 months?
I know from my standpoint, I don't know that I would be comfortable. I wasn't comfortable this summer. I'd struggle to feel that we'd be able to implement anything yet, especially someone on treatment. Off treatment is a little bit different scenario probably, or, you know, siblings, but then again, what is a sibling potentially going to bring home, or when you start bringing into family camps? So at least for right now. Now, to be fair, I'm in South Dakota where we are having a huge spike right now. We've got like 1,000 new cases in the state today. So for us, I don't think anything's feasible anytime soon, but I think that's another part of this challenge is it's going to be so different depending on where you are. And if I'm not mistaken, Lauren, Canada has pretty much said even camps for 2021 are not going to happen. Is that correct?
At least like from the oncology side, I don't think any of us at this point think it's safe next summer to run overnight. I think there'll be opportunities for in-person depending on what public health looks like. But yeah, we're still mandated not even to run overnight camps by the government right now.
Sure. How about other folks that are on? What are you guys thinking?
Hi, everybody. Dennis with Camp Tecumseh in Vermont. We run in partnership with UVM Medical Center's pediatric oncology unit. So we are pretty much directed by Dr. Homans at pediatric oncology here. He's the one that shut us down this year, told us we were not able to run anything. And he has also shut us down through April of next year at a minimum. So we've already notified our families that everything we do virtual, because we have programs every month, will be virtual through April. But he shared with me on the phone earlier this week that he is pretty sure we will continue to be remote through the end of 2021. He does not see us realistically coming back together until maybe some of our winter programs in 2022. That's just where, I mean, Vermont tends to be extremely conservative in this, as you probably have seen. We have extremely low numbers as a result of that conservative stance. We had just a couple of thousand cases in the whole state. But our medical center is very conservative. So my guess is we probably won't be back until 2022 up here in Vermont.
Okay.
We tend to follow Canada just north of us.
Others that have had these conversations yet, or other medical directors that are on?
I'm not a medical person on our staff. Actually, Amy down there is our camp nurse, but I am the camping manager. So I've actually started reaching out to, and our camp is a national camp. So I started reaching out to some of our top recruiters at different hospitals to essentially do the same thing and just kind of ask some of those same questions. And so far, I've only had a couple of those conversations, and it's kind of a mixed bag because everybody wants to say yes, that they want to be able to send people. But then other people are realistic about, we don't even know what Thanksgiving's going to look like, let alone next summer. So it's hard to have those conversations with some people because next summer is so far away. I mean, if you have camps going on in the next couple of months, that's different. But so many people are just like, can't see past this week.
I'm in Texas, and Renee and I have had, my other co-director have had some of those conversations. Like, do we totally pivot our programs? I know that our peds oncologists have been like, let's see what happens with the vaccines. One of our oncologists is actually in the trial, so he's sure he's immune. But but then we were like, well, do we try and pivot to maybe family camps where they're just staying with their family and it's smaller pods and doing it over several weekends? So we've thrown some ideas out there. It's just hard to think about, we normally have 125 to 130 kids. I don't see us being able to do that even this summer. And I don't know, even if the vaccines are out and available, is it going to be the same with our on-treatment kids where the vaccine's not going to take anyway? So.
Right. Okay.
This is Susie again. We tend to, I would also say we're fairly conservative, and I think realistically, we're questioning what's going to happen this summer. We have programs throughout the year. We've been just making decisions kind of program or two at a time as they come in the season. But I think the reason we want to start working through the guide is that we don't want to find ourselves unprepared just in case something does change. And I think we usually open applications in early January, and we want to be able to clearly tell parents, whether or not it's January or February, what the expectations will be if there is an in-person camp by some chance. And also, just be able to also on our application have some choices. So if we need to stay virtual, will you be planning to send your child? Or, are you open to virtual or in person, depending on what that looks like? So we can start making plans. We usually have about 220 kids per week in a 2-week session. And so we anticipate significantly reduced numbers. We are going to our campus to do kind of a walkthrough in about 3 weeks. As we begin, we're going to do a couple days of retreating with just a very small core group of people, socially distanced, masked, but also to be able to walk around the grounds and look at, our bed spaced well enough. Can we do head to toe beds and all the different things? And cafeteria wise, what could we accommodate in the cafeteria, or could we pitch a tent outside if we needed to? So there's just so many different things that are in that we need to think about. Whether or not we go this summer or not, we wanted to be prepared either way.
Sure. Well, I think you hit on something that's been raised in the chat room too, or in the chat about already having challenges recruiting enough medical volunteers. How early are people going to start thinking about recruiting? And do you think we're going to need more staff than we're used to having because of social distancing or having more pods, or, so say things do work great and we all get wonderfully surprised and get to have some form of in-person camp. What does that look like for a need for medical staff? I honestly don't know, because I haven't thought about that yet. So I'm curious if anyone else has.
I'll speak a little bit about that. I think if we do have in person, it's going to have to be reduced sizes. And so in that sense, if you count the numbers, probably you'll have less kids and less volunteers and less staff. The camp, we use medical staff. So I hadn't thought about that it would be more difficult to recruit medical staff, but it might be. The camp we use has been successfully this fall having in-person family camps, and they do it in pods. So each family goes to the activities together. The family stays together. They eat together. Their other families are not close to them when they eat, or they get their meals outside at the canteen and take them someplace else. So it's a very, very different experience compared to what our family camps normally are like. So if a lot of you do family camps, part of it is the connection with the families and getting to know each other and the kids playing together. It's a very different experience. But they said on the positive side that they've gotten from the families, that the families are very grateful for the opportunity to be at camp, and the connection with their family unit has become stronger. So they're not connecting with other families, but their family has an opportunity to connect in a way that they don't at home. So I know that that's kind of an option that they're looking at with other partner camps, which are special needs, not necessarily cancer, but other kids with medical issues. So I think that if we do in person, if we're lucky enough to, it's going to have to look a lot, follow the ACA and the CDC guidelines, and they're going to have to be pods, and they're going to have to be at 50% capacity unless things drastically change. I'm not going to give up on that. I'm not going to give up on the possibility that we can't try to do something, but I think it's a long shot. So
Yeah.
Anybody's seen any of the literature lately? I know that I was on a webinar with a peds onc out of Sloan Kettering, but that was like back in the spring, where they were seeing actually kids with cancer having less side effects. And I thought I saw something pop through in one of my news briefs for APON, but I will be really honest, I haven't tracked that so much, but that was one of the things I was going to try and, as we started pulling our planning committee back together, was one of those things I was going to try and track down, because it's like, okay, is it true? Is it not true? Are our kids not being as affected or not having as many side effects if they, God forbid, do get COVID?
So there are a couple of research studies that are out there right now that are tracking this. It's, I mean, obviously early in the tracking, but I think there's one that's coming, if I'm not mistaken, I think there's one out of St. Jude that's kind of doing a registry. And then there's another one I believe that's coming through COG as well. So that may give some information. I'm not sure when we'll get much of it to make any decisions off of, but it at least might help us get a little more focused, or at least get information all in one place. So hopefully that will continue to be useful. But the other thing I was thinking about from a staff standpoint, if testing becomes necessary, you know, how do you manage who needs to be tested and how often people need to be tested, and just the logistics of dealing with that. Plus, having had to get the test a couple of times myself, it's terribly uncomfortable. I can't imagine campers being really excited to do that more than once, let alone a couple times in the same week. Okay, let's see. What else have we got coming up in the chat room here? Questions about, our volunteers come from all over the county and with various hotspots. Would you allow him or her to attend camp? And if so, would you require quarantine and a test, or quarantine alone? Oh, Leah, you're not asking anything easy. And probably part of it's going to depend on when your camp is and which hotspot is when, and if someone can quarantine for 2 weeks, which is probably going to challenge your volunteer load. Others have any thoughts on that question?
So when I developed our policies based on the ACA field guide, they have kind of the good practices, better practices, and best practices. And a better practice was asking everyone to quarantine for 2 weeks beforehand. And then their best practice was to quarantine beforehand and to get a test 3 days before, within 3 days of arriving at camp. So we're trying to be as safe as possible. So I think we're going to go with the best option that ACA recommended.
Okay. If you do require testing, is that something that your camp will pay for? Is that something that you would expect your volunteer to pay for? Where does that fit into it?
So we would pay for it. We're currently looking for grants to pay for it. I was on a Zoom webinar with a few camps from Maine that opened, and they did testing, and their testing prices were, some of them paid $30,000 for testing, and another camp paid $150,000 for testing. And these were private camps, but you know, they are predicting that the cost will go down as more tests become readily available. I know one camp actually went overboard and got a machine at camp that ran the tests for them, but
Wow.
it is costly to do. But that's why we're trying to search early for grants that would allow us to do it.
Ryan, I'm just curious, are you also planning to test campers on arrival? Because that's actually one of the other recommendations in the field guide. And then also midweek, right, I think?
So those are kind of ideas that we're bouncing around right now. We do 5 sessions of camp, and normally we do, they come on Sunday and they leave Thursday. So we're going to do the monitoring daily. And we're bouncing around the idea of extending our sessions to kind of create a bubble. That's what the camps in Maine did. They kept them there for 4 or 5 weeks at a time. And then after week 2, they kind of were able to breathe a little bit deeper. So we're considering that. We're probably going to be testing our staff at least a couple times throughout the summer, and just doing the monitoring of our campers.
Susie, I'm looking at the field guide, and it says, it talks at least about pre-testing carried out within 7 days prior to arrival, on-site at arrival, and then potential cases as well as surveillance carried out during the camp season. But then there's a footnote that talks about what that surveillance means. So, okay.
I know one of the things that we're at least is in my mind, it's not shared probably too publicly yet, but we allow kids to come for 2 weeks. And I do believe that that second week, kids get very run down, they become more susceptible to things. That's the week they tend to get sick. And, also too, we have turnover of staff. And I think the amount of education that's going to be required this year of your staff coming in is going to be significant. And so I'm actually going to propose the idea that maybe the staff come in on Saturday instead of both staff and kids. And then the camp, if we would be able to do this, and then the campers would come in on Sunday. So you had all day Saturday to do your screening of your staff, to do your education of your staff, to ensure that everybody's comfortable with all the many changes in protocols that have occurred, and really have an opportunity to provide that rationale behind, what you're doing and why you're doing it and how important it is to do these things in order to be able to safely conduct camp. And again, by no means am I saying we're having it, but we just really want to think through that. And also too, we also always think about, how well is our campsite cleaning, and who's going to do the daily touch point cleaning. You definitely can't ask your counselors to do that. So do we need to hire somebody in addition to come in and do that for us in all the different cabins? But looking at that second Saturday then as a complete turnover and a complete cleansing of the entire campus. So there's, as I said, there's just a lot of different things that you really have to think about. And do you have the right people doing those things? One thing that somebody did suggest, as I was thinking about all the screening that has to take place, is, they said, well, do you really need a healthcare professional to check the temperature and, do the screening questions, or can you have some lay people do those things for you? And then if there's a yes answer, or somebody's got a temperature of X, then they get referred to, a medical person to do further investigation of the issue. So I do think that's a real possibility to do some recruitment of non-medical people to help you with some of that screening.
Well, and realistically,
Someone who's gotten, I'm sorry.
I was going to say, realistically, at most hospitals, your screening questions are being asked by check-in staff and probably not licensed medical professionals. So that may be a very good way to use other people that want to help and don't have a different role.
Right.
So, sorry.
That's what I was gonna say as well, just because I've been pulled to help train those people, and so.
And Susie, I can touch on a few things that you said. We own our own facility, so we rent out our facility as well. We couldn't this year, but we're going to do it next year. And we're in New Jersey, which had some of the harshest restrictions on camps this year. Residential camps weren't able to operate, but family camps were, so we're considering family camp. But also New Jersey required a lot of upgrades to our facility, so we already installed UV lights into all of our ductwork. We sanitized our ductwork. We had to upgrade all of our HVAC units to allow for fresh air intake. And we already ordered 4 or 5 tents for next year. One of their recommendations was to do everything you possibly can outside. So we're really not even considering using our dining hall. We're going to have a patio area that with a tent over it, and we're going to do most of our eating outside, arts and crafts. If we did a talent show or something like that, it would be outside as well. And then what New Jersey told us is they actually offer a kind of a certificate program, so that it just basically tells you what to look for when you're screening for symptoms. And then whoever has that, anybody can have that, not just medical professionals. And then they can do all the screening at your camp as well.
Ryan, are you hiring out for consultation?
We've considered it. Oh no, sorry. Yeah, go ahead. I'll give you a discount. But we are actually hiring too. Another point that you touched on, we're calling them super cleaners that we've never had in the past, and it's just going to be 2 staff that just go around and do all the touch points and clean all the common areas throughout the day. So we're going to have a maintenance staff, a assistant maintenance staff, and then 2 super cleaners, and the super cleaners just literally go around cleaning all day.
Lauren, what was the link that you shared in the chat?
Oh, just to the ACA field guide. So if anyone wanted to pull it up while we're chatting about it.
Perfect. So it's there if someone doesn't have it or you want to grab it. Okay. It certainly sounds like, Susie, to go back to something you brought up at the beginning, it sounds like there would be interest in maybe periodically meeting to go through some of these guidelines to try to work through as a group what people might be doing. Is that something people would want to participate in every couple of month roundtable to go through those things? Can certainly feel free to let us know if that's an interest.
Absolutely an interest.
Okay.
When you're talking about testing, I mean, there's such a variety of testing that's out there.
Yeah.
And the one that you talked about that was uncomfortable, I mean, I think is the gold standard, but
Right.
what about some of the other testing? Do you think they're valid? Do you think they're not? I mean,
I've had mixed results with the other kinds of tests. The rapid test can be, false negative. You can get some false positives with them. We don't have any antibody testing that we're using at the hospital where I work, so I don't have much knowledge of that. But, again, how do you know enough? And if has already been brought up with our patients, just because they didn't make an antibody might not mean anything because their immune systems aren't often not going to make an antibody. So yeah, that's something else, is what test are we really going to do that we can trust? And outside of camps that purchase their own machine, how do you even get that test result in a reasonable time frame? Yeah, every time we have one of these roundtables, I'm left with more questions than answers more often than not, but it's still nice to know that I'm not the only one with the questions.
hey, Matt, maybe the ID doctor can chime in on that at the panel.
Yeah, I'm gonna say, don't forget the future of camping session is gonna be coming up as well, and we may get some of these questions addressed there too.
I'm writing some things down, and Dr. Rafi and I have spoken, so he has some ideas of the questions and concerns that y'all have come up with throughout this summer and up till now. So, hopefully he'll have some insight on what the future looks like for us.
Matt, remind us of when that session is, please.
It is tomorrow at
4?
It is, oh, I'm looking at the wrong one. Yes, it is tomorrow at 5 o'clock Eastern time.
It'll be a great session. So everybody, if you get a chance or have someone from your camp that can sign in, please do so.
Hi, everybody. This is Trisha from Case Camp in Delaware. I just wanted to point out that I think the biggest downfall with the testing is that there's a lot more false negatives in asymptomatic people. So I think we need to be aware, if we're screening all campers and staff before camp, we need to also look at local trends of infection and where people are coming from, because the chances of us getting, a false negative result and having someone come into camp that can then spread COVID is going to be a lot higher.
Yeah. Is it going to give us a false sense of security with someone that has symptoms that you should be thinking about, but you're going, well, his test was negative, so
right,
fine. Yeah.
And then also our governor just had a press conference today. They were talking about cases of transmission in schools, which have been generally very low, but the few clusters that we've had have been kids that were involved in out of school parties, sleepovers, or events where they were eating unmasked in non-family groups. So that's essentially all of camp. I mean, it's hard to avoid those things. So thinking about ways we can space out our campers when they, have to take off masks for things, thinking about sleeping arrangements are all going to be things that I think is going to make, a lot of in-person camping activities, especially where you can't have parents and family groups where kids are, in multiple child groups, really, really hard this year. But, it's something that we're going to have a lot of backup plans, I think, as we move forward, and then decide at the last minute which plan we can go with. It's safe based on how things look, 2 weeks before camp or 4 weeks before camp.
Anyone else?
Nightmare.
Maybe a chaperone and not let kids get near each other, sort of like a junior high dance. I think that's going to be really hard. Is kids' natural instinct is to be near each other and be close to each other. That's part of what camp's about, and that's going to be, I think, a big challenge as well.
I agree.
So all the seminars that I've listened to from camps that were open this year, their main message was that the kids did anything that they were asked to do this year because the message was driven home about how important camp was, and all the kids realized how lucky they were to be going to camp this year. So they said that they also considered that they would have problems with 6-year-olds wearing masks all day long and everything, but that basically none of those camps had any problems with it. The kids had total buy-in, the staff had total buy-in, and they all said that it was the best year that they've ever had in their entire camping careers because everybody came together. They kind of did the impossible, and it was like a whole team effort from everybody.
Nice. Okay.
Yeah, that's awesome. And that's what we're seeing in our schools too. And you know, my kids are in school 5 days a week. I think the issue is just making sure that like groups are always supervised with people that can remind them. Because I think in out of school or unsupervised activities, then you know, behaviors tend to slip a little bit. So and the eating is the big thing, you know, but in the summertime, if we can space kids out and they can eat outside in a tent or something like that, that's definitely safer than, you know, having them all together at the same table in a cabin.
Sure.
Just logistically a lot different than what we're used to thinking about. But I agree. I mean, I think most kids are pretty good about wearing their masks with some reminders. And hopefully by summertime, this will be like second nature to them.
Other comments, questions about that? I know COVID and all of its changes about camp are on everyone's mind. Is there any other questions, topics outside of COVID that people wanted to hit on or wanted to bring up questions about?
Dr. K, I'll just offer, I'm not part of the medical staff either. I'm the executive director for Camp Tecumseh. One of the ways that
That
we
makes you part of the medical staff because you make decisions with your medical staff.
That's true. But part of the way I've kept my medical folks engaged was we are in a heavy review process of our policies and procedures and just really taking a deeper look at things that we often don't have time for. And I've got people signing up to help with different things. And ultimately with the goal of making us better when we are back in person. And they've been very, very receptive to that. And I've really kept them engaged by doing that. So I don't know if that helps others, but it was one way for me to help to keep them engaged. We're going to replace our software system. So I've got 4 of them on the hook helping me with that right now, which is really great. So just an idea.
We actually went through a whole revision of our policies as well, partly because we were online to be gold ribbon visited, which didn't happen, of course, but something that's now going to be a new thing for us. South Dakota just passed marijuana for both medical and recreational use. And prior to this, my policy was it's illegal, done, but that's going to be a new review that we're going to have to do again. And hopefully we'll have some time to do in this winter, which actually is currently hit. We're in the middle of a blizzard right now, so I'd rather be in Houston. But anyone else going over their policies or having other policies that you're trying to decide what to do with outside of infectious disease?
I'm glad you brought up the medical marijuana because that just passed here in Arizona last week. So that is something that has definitely been on my front burner. I think we haven't even touched on it. So I'll have to contact our executive director and the rest of our camp leadership and say, hey, we do have to address this. Yeah. I think everything is just so overshadowed by COVID right now, but I don't want to lose sight of other things like that.
Right. Because at some point, I think we all are, maybe this summer if we're really lucky, but I mean, in-person camps coming again. And like you said, we've all been focusing so much on COVID. Are we going to lose some other things that we need to make sure we're addressing? So,
right.
We just kicked off, or we'll be kicking off a new medical working group. So we've got our advisory committee and that, but I just had 12 medical volunteers willing to be on this group, and the real focus is going to be on performance improvement opportunities. So taking a look at the things that they identify when they come to camp that we could be better at, do better, and we're going to break up into small working teams and hopefully tackle a lot of those initiatives. So that's been another way to keep them engaged.
Okay, I like it. Do any of you involve nursing students, residents, any trainees in these policies or in these working groups?
So it was open to anybody who had volunteered for camp. So we've had residents, and I didn't open it up to nursing students, but definitely to our residents and fellows if they were interested. I think they're a little busy with their other responsibilities right now, so I didn't get any takers on it. But we asked for some minimum time in the medical program in order to be one of the volunteers on that group.
I have another question, and this is like totally digressing.
Sorry.
So I haven't been to a COCA conference since it was in Dubuque, Iowa, which might have been 5 million years ago. So I'm really happy to be back. But one thing, thank you. One thing I'm seeing on here that I really love is people have included their pronouns in their names on their Zoom screens, which, full transparency, I just literally figured out how to do about 10 minutes ago, because it was my nickname, which is Mealy. My name is actually Camille. So do any of your camps do for your staff gender fluidity training? If you do, where have you found that? I mean, I did some training at Phoenix Children's Hospital, but it wasn't, it was very specific to the team that I was on. And I really think, my 7th grader came home the other day and she's like, what does binary mean? And I explained it to her, but this is something that our children are talking about. I'm glad they are. So what do you guys do with this with your staff? How do you address this with your staff, if at all?
We actually just finished our policy kind of about that, but trying to figure out exactly that question is like, how do we educate our staff so they know how to kind of support everybody together. And we haven't quite figured that component of it out yet. But yeah, I'd love to hear that as well, if people have ideas of where to get some great training.
The Pride Camping Association actually has some really great resources on their website, but then they're also super lovely. And if you reach out to them, they love to collaborate on trainings and things like that. So they're a great resource.
Wonderful. Thank you.
Matt, do you want to say a bit about the diversity initiative that COCA is working on?
Yes, so we are actually in the process of our diversity and equity team is putting some things together for the new year, specifically to talk about issues of race and gender identity and sexuality in camping. So we are actually in the process now to do that starting in January. I have secured one speaker to start us off, to kick us off in January. So we're hoping that, we'll be able to do something, if not every month, every other month, to really try to educate our camps on the different aspects of diversity in our camping. I know for example, I just actually finished a training not that long ago in New Jersey. We have an amazing organization. I will put the link in the chat in a few minutes, that does primarily, their specific purpose is to train schools and organizations on the issues of gender identity and sexuality. And their presentation was absolutely phenomenal. It was geared towards teachers. I am a teacher. So it was geared to us on how to educate in our classrooms, and also how to field questions, especially if we have a student who identifies as non-binary or fluid or what have you. So I think it can easily translate to the camping world. I've had several campers who identified as transgender. So we've worked with those campers and their families to make their experience as meaningful as any other camper. So we'll definitely look forward to the new year with all of those programs that we're putting out. And I will put the link to the organization in the chat so everyone has it.
And Lauren, they'll be able to see the chat when they see, if anyone sees the recording of this, right? If you can't remember some of these links, that will be viewable if you come back. So she's put in a couple of resources and Matt will add a couple as well.
Yep, and you can feel free if you miss something, you can shoot us an email or a message and we will make sure that we send that all out again. That's not a problem.
I'll just offer, Dennis, with Camp Tecumseh again. We currently have 2 campers that that are either transitioned or in transition. So this is something very near and dear to our heart and our program. We engage the university locally to bring in trainers to talk with our staff about it and to educate us as staff. I used to work at the university and have close friends there that I can call upon to help in that regard. But a local university or college near you may have an LGBTQA center or a Pride center or something like that, where you may be able to find resources too. So I thought I would offer that up. And GLAD also has wonderful resources online as another option for you to look at. So.
Hi, this is Gretchen from Case Camp. So, sorry, I'm trying to put my video on so you can see me. Here I am. So we have also changed all of our operational guidelines to include, LGBTQ policies, as far as having bathrooms that are not assigned by sex, that we have gender neutral bathrooms, and that even on our applications, we ask what your camper identifies as, so that even with the application, like let's say, Matt comes to camp and Matt's mom and dad have put on his application, he identifies as a male. And then what happens when Matt gets to camp, it says, no, I identify as a female. So we do have policies in place on how to deal with that, as well as support the camper throughout the week, and that our expectation is they can be whoever they want to be at camp, and that we allow that space to be that. So many of us have, go by nicknames at camp, and that's the only place that people call you that name. And so we kind of allow that, and we've put in policies and procedures so that all of our campers can be whoever they want to be while they're at camp, and that we do have policies and procedures to kind of protect their rights of being the individual that they want to be.
Other people have policies that they have in place that they want to talk about?
There is another question in the chat. Dr. K from Ashley at CQ Ohio, just wondering about recruitment for doctors and nurses pre-pandemic, and if anyone's had issues with that as well, or it's been a particular challenge.
What strategies do people use to recruit medical professional volunteers? Your nurses, your docs, whichever group.
This is another time when I wish Mary Ellen was on, but she's teaching tonight, because Mary Ellen actually has a presentation. Our medical coordination director at camp has a presentation that she's actually given at COCA before about how we're able to recruit. On average, we have each camp year anywhere between 35 to 40 nurses and doctors that volunteer their time the week of camp. And what's probably the most interesting fact of that, and Dr. Trisha's on here, so I know she'll enjoy this, but the 90% of our campers come from Area Children's Hospital, A.I. DuPont Children, Nemours, and we get one medical staff from their facility. Actually, the other large medical facility in our state, Christiana Care, is where 99% of our medical staff come from, and that's doctors, nurses, including pharmacists. So, Mary Ellen and her crew have done a fantastic job at making it really flexible. We initially tried to, years ago when we started camp, we wanted, nurses and doctors to guarantee 3 consecutive shifts. And we found that was really not able to happen because, everybody's either volunteering their time or what have you. So her and her staff have allowed, people to kind of just come in and go when they need to, and they've plugged people in. Our medical staff all travel with our campers. So that's kind of another, a bonus. You're not just sitting in a medical facility waiting for somebody. They get to go to all the activities. You know, if kids are healthy, they're out canoeing with the campers. They're making tutus, as Dr. Tricia and Dr. Dorothy, that they just put on a session in our virtual camp this year. So they're also able to interact with the campers in a different setting. And I think that kind of helps with recruitment and as well as retention, because almost all of our nurses and doctors return each year. And so, you know, and just like anything else, it's word of mouth. You know, you got started in camp probably because, you know, somebody said, oh my gosh, this is a great opportunity. It's so much fun. It's the same kind of thing. And we've been really successful with our medical program. So shout out to Mary Ellen, who's not here, but you can all tell her I told that. Okay. Just saying.
Okay.
Yeah, definitely word of mouth. I beg people the first year, and then like when they come, I give them fun activities or a fun cabin, and they all want to come back. And feeding them well doesn't hurt either. So lots of coffee, lots of chocolate. But I would reach out to your staff who already volunteer and see if they each have, you know, 2 friends that want to come along next time to camp, and that really does spread like wildfire.
So Gretchen, we do something similar. We decentralized our medical team quite a few years ago. We keep a very small core staff in the medical office, and then we have teams that work with the 7 different programs at summer camp. And they love being with the kids. It actually has made their role so much more fulfilling, because and the reason we did that is I started asking people why they didn't want to come back to camp, and they said they didn't want to hang out in the medical office. We also recognize that with all of our survivors and all their different types of needs, that you can actually have a diversity within your team of specialties. So we have our core team of the pediatric oncology people, but we love having our ER people, our ICU people, our neuroscience people, because when you think about seizures and adrenal insufficiency and all the other things that you're managing, we all can't be experts at everything. And so our teams oftentimes consist of a physician or advanced practice provider with nurses, and it really strengthens that small group and has been really fulfilling. I probably shouldn't say this, but we actually had 68 volunteers over the 2 weeks of summer camp last year.
Wow, you should share. That's awesome. You should absolutely share that.
And a lot of them continue to come back. So, you know, I think we are finding there's some different things that we can do, you know, to better precept them and you know, help them in that first year. And those are some of the things that working group is looking at.
Yeah, Mary Ellen and them are also great at, like, you know, several of the nurses are not oncology backgrounds. You know, they're coming from different areas, and so, you know, the scary thing is, well, I don't know anything about oncology. And Mary Ellen and Dr. Tricia and Dr. Dorothy, they all reassure, like, that's okay. We have our core group. We know what we're doing. All we're asking is that you go, and you're that medical, you know, you're kind of that medical safety blanket that, you know, our staff kind of rely on that it's a great comfort. They don't have to think, oh, well, I wonder why they have a headache, or I wonder why there's some, they don't have to worry about that. And so that just comes naturally, obviously, depending on whatever, you know, area of nursing or even the doctors are in. And so, you know, Mary Ellen, I've got to give her credit. She's really good at finding, people can't really say no because they don't, she just constantly says, well, oh, is it time? Okay, well, if you can't give me a full shift, can you give me a couple hours? He's got one doc who's been coming for years. He says, you get 4 hours. You plug me in wherever you want. You got 4 hours. He's an ER physician, and he'll always come out and support. So, you know, I think being flexible as much as you can within your own programs is key to that too, that, you know, you realize everybody's different, and, you know, everybody has different shift work and things like that. We understand that. And, you know, luckily for us, most of our hospitals, I mean, the main hospital that we pull from is anywhere from 20 minutes to 30 minutes from where we're at. So that's kind of nice too, that if they wanted to come right after work, they could come and do a couple more hours at camp. So we're lucky in that respect.
Recruiting from the residency programs is really good too if you have access, and they actually love it. I've also taken nurse practitioner students. So you've got a registered nurse who needs to get her practicum done. And so that's actually been really beneficial on both sides.
Someone had mentioned, you know, people will say that they're afraid to take care of oncology patients if that's not their background. Remember, COCA does have a couple videos that we made last year for helping medical staff who aren't oncology. But then we also have for those of us that are oncologists and maybe don't remember what to do about some basic camp stuff. So those are a couple resources that are out there. And I will also say, just from my standpoint, our medical staff is decentralized as well, and I love it. It's so much fun to get to go out on the tubes with the kids, and I every once in a while end up a target on a paintball course, and I think it's fun for the kids to get to see their nurses and doctors and child life specialists in a totally different realm, and it's a lot of fun for us too. So certainly, if that's feasible for your camp, and encourage your medical staff to be involved and be part of the activities if it's at all possible.
Okay, there is a question in the chat regarding purchasing of supplies. If there anyone, let me just get it for you.
Oh, for those camps that are not affiliated with directly with children's hospitals, that type of thing.
So Camp Periwinkle pays for all of their medications they need, but they struggle as a foundation could buy the IV tubing, lab supplies, dressing kits, etc. Her question is, do any of the camps purchase any of these supplies? If so, what's the secret?
We do.
Oh,
Go ahead.
I was gonna say, we don't do that now, but when I worked with Camp Discovery in Central Texas, the hospitals would donate some things, but we actually hooked up with a home health company that actually became part of the board for Camp Discovery, and they made a commitment to help do some of the tubing and that supply thing. So there might be the hospitals might be able to give you some of the home health companies that take care of the oncology patients a lot, that might be willing to spread that amongst the home care agencies.
And I will tell you, there's a connection from Milan where you can get EpiPens donated. You just have to fill out a form. We found it online. I don't remember the exact website. I apologize, but you just have to fill out a form. I sign a prescription, and every year we've gotten, I think, 6 pens. So that's a nice resource at no cost to the camps. So if you haven't checked that out, go ahead and do that. Deb, you had asked about if the videos are on the website. I don't know where they are, but I will find out from Dawn where those videos are posted.
Thank you.
I put this in the chat, but we use a company called Henry Schein to order a lot of our antibiotics and Zofran and things like that through. You do have to have a medical professional who's willing to kind of be your person on the form. You do have to have a licensed professional, but if you have somebody who's willing to work with you on that, that's another way to get some of those supplies. And then we've also had really good luck at least getting things at cost from some of the medical supply companies.
I have a question kind of going off of that. This is Amy. I'm the nurse working for Camp Make a Dream. And our facility is out kind of in the middle of nowhere. And we do ask the campers to bring all their emergency meds. But we have in the past had Ativan and some other emergency meds available just because we have a lot of brain tumor survivors as well. Does any other camp stock emergency meds? And what's the trick for getting access to those?
We stock some, but I'm owned and sponsored by a medical center, so I have access through that.
Okay.
How about other folks? What do you keep on hand?
Same thing here. Our hospital staff brings it with them, and then, if it gets used, it either gets charged out to a patient or to us or whatever. But yeah, they bring it from the hospital.
We don't usually keep the controlled substances, but we usually have Salumedrol available. Even though kids are supposed to bring their emergency meds, we know that they don't always. And so we always want to make sure for those kids who are adrenal insufficient that we got Salumedrol available. We also keep the EpiPens, and we also keep some stock inhalers available as well.
We do the same thing. We have a stock of EpiPens that we get through one of our APPs, and we keep albuterol. We have, I don't even know, I have to check the expiration date of our Salumedrol, and that's it. We are about a half an hour away from a major medical center, but we have EMS within 5 minutes. So we have a really good relationship with them, and we just sort of rely on them for everything else.
I've partnered with
from
some
an emergency standpoint. Not everything else, just from an emergency standpoint.
I've partnered with one of my local pharmacies that we send a lot of our kids to, actually, who have agreed to give us kind of like a camp stock of like baseline antibiotics, Amox, prednisone, you know, Keflex, eardrops, like simple stuff that you could use at camp instead of having to go to the local pharmacy in East Bumble where we are. And I also work with our local pharmacy in-house that's able to give us supplies as well. And I just have to bring them back whatever we don't use.
So I'm going to jump in. The time right now is 9:01. So we're a minute over our session time this evening. I want to first say a big thank you to Dr. K for joining us this evening and facilitating this conversation and answering questions. I know personally, I just find it so great to connect with everyone else and know that we're all going through the same thing right now. So it's just great to hear from everyone. A couple of announcements. Tomorrow morning, we'll be starting at 11 a.m. with our Meet Away, Meet Difference Maker. And then at 12 p.m. Eastern Standard Time, we'll have our medical roundtable number 2. So come on back with more questions. Think about them tonight. And then tomorrow, also at 5 p.m. Eastern Standard Time, as Matt was saying, we've got the Future of Camp session, and that's going to be one that you don't want to miss. Right now, Matt is going to throw up a poll for the session this evening. And I'm going to put the evaluation for the CEU track in the chat. Oh, Matt's already done that. Great, he's all over it. So take a moment and fill those out. And if you're looking for any of those resources that were in the chat this evening that you missed, feel free to email us and we will get those to you. Thanks for coming, everybody. Have a great night.